Hi, I'm Amanda Stretcher and I'm a licensed professional counselor supervisor. And let's talk about divorce trauma and if you can experience PTSD after a divorce. Divorce can be traumatic. Some people may experience PTSD symptoms after this separation. Abusive or toxic relationship dynamics can contribute to the development of post-divorce PTSD. Whether or not divorce trauma warrants a diagnosis, coping with divorce starts with validating your feelings and seeking professional support. Now, let's go over what PTSD is. Post-traumatic stress disorder, PTSD, is a mental health disorder that occurs after experiencing traumatic situations or events. PTSD symptoms can impact people of all ages, and symptoms can significantly affect all areas of life, including relationships, jobs, physical, and mental health. Some common symptoms of PTSD include hypervigilance, which can show up as heightened, exaggerated responses to stressful situations, intrusive symptoms such as intrusive thoughts, feelings, or sensations, avoidance behaviors, including avoiding things, people, or places that remind the individual of the traumatic event, recurring memories experienced as PTSD flashbacks, nightmares, or panic attacks triggered by memories or thoughts of the trauma, interpersonal relationship problems such as difficulty trusting or relating to others the way they could before the trauma responses that can result in automatic fight or freeze responses when faced with trauma reminders such as familiar smells or sounds, and physical symptoms like headaches, unexplained aches and pains, and digestive problems commonly reported by people with PTSD. Before I continue, I've linked to our in-depth article on divorce trauma and some resources for support in the description below. Also, help us promote quality, reliable mental health content by subscribing to Choosing Therapy and liking and commenting on this video. Okay, now that we know what PTSD is, let's go over whether or not divorce can cause PTSD. Ending a marriage is seldom easy, even if the relationship is toxic and abusive. While not a clinical diagnosis, divorce trauma may develop from the separation process or from events experienced during the relationship before the separation. For example, some people may view their divorce as especially traumatic if their ex-partner was cruel during negotiations, refused to cooperate, or intentionally behaved in ways to cause emotional pain throughout the process. Those who experienced coercive control and other psychological abuse during the divorce process are most at risk for developing post-divorce PTSD symptoms. Additionally, a personal or family history of anxiety or depression may increase the possibility of PTSD due to pre-existing or predisposed symptoms. Ex-partners are not necessarily the only ones who experience symptoms of PTSD following a divorce. After their parents' divorce, children may also experience PTSD, especially in situations where there was psychological or physical violence. Children need support to handle stressful events like divorce. Children exposed to the drama and sometimes cruelty of divorce may feel unsafe or undersupported, making them more likely to experience PTSD symptoms. The risk increases for children whose parents are involved in prolonged, ongoing conflict. Some symptoms of PTSD in children may include changes in behavior, changes in sleeping patterns, decline in academic performance, changes in appetite, self-harming behaviors, avoidance of places or situations, reenacting the trauma in play, acting out, potty-trained children, wetting the bed, and nightmares. A person can experience a broad array of post-divorce PTSD symptoms, manifesting differently depending on their situation. These symptoms can contribute to avoidance behaviors, things like avoiding places, persons, or things associated with their ex-partner, and in reluctance to explore new relationships. Common symptoms of divorce trauma include exaggerated self-blame or blame of others, irritability, divorce grief, aggression, negative self-talk, reluctance to meet new people, avoidance behaviors, nightmares of the events that took place during the divorce, and a racing heart when triggered by the memories of the ex-partner. If you find yourself struggling with divorce trauma, here are 6 tips I recommend to help you cope. First, accept how you feel. Accepting your emotions can help with healing. It's common to feel empty, lonely, guilty, abandoned, or resentful after a traumatic divorce. There's no right or wrong way to handle this experience, so allow yourself to feel your emotions and accept them as they pass. Using relaxation strategies can help reduce symptoms of trauma after a divorce. Consider trying a mindfulness routine, deep breathing exercises, meditating, trauma-informed yoga, or really any activity that makes you feel calm and relaxed. Next, validate your experiences. You may face judgment from people who don't understand how difficult and traumatic divorce can be. Validating your own experiences is crucial in managing your PTSD symptoms. Remove pressures to heal quickly. Remember that healing from trauma after divorce takes time, especially after losing your partner. Your symptoms may not improve immediately, but you may experience positive growth after a few months. Be patient with yourself. Take time before dating again. Examine why you feel pressured to get back into the dating world. Are external factors guiding this feeling? Do you maybe feel an obligation to provide another parent for your children? Are you struggling with loneliness? Allow yourself time and space to heal before jumping back into the game. If a friend or family member offers to set you up with someone, it's okay to say you're not ready. And lastly, examine your relationship patterns. For some people, a traumatic divorce is not an isolated incident, but a pattern of many dysfunctional relationships. If you relate, look at the repeated patterns you notice in your past relationships. Doing so can help your inner wounds heal and decrease your likelihood of having another traumatic experience. Along with positive lifestyle changes and coping skills, various PTSD treatment options can help you manage divorce trauma. If you're ready to seek professional support, consider exploring local support in your area or an online therapist directory. Therapy for PTSD can be beneficial after a traumatic relationship or divorce proceeding. If you have children, consider finding a therapist specializing in the effects of divorce on children. In some cases, providers may prescribe medications for PTSD to help individuals cope with symptoms, and many recommend using medication alongside therapy. Splitting up with your ex and dealing with divorce trauma can be especially difficult to navigate. Remember, you're not alone. I've linked to some resources in the description below to help you find the support that you need.